how to actually find your family's health history, not just what you can remember. Most people know far less about their family's health history than they think. Here are some tips on how to properly check yours. First off, ask your living relatives directly. Parents, aunts, uncles, grandparents, cousins. Ask them specifically about illnesses like cancer, cardiovascular disease like heart attacks and strokes, dementia, and try to pin down vague answers. So for instance, is there a family history of commonly inherited cancers like bowel, breast, ovarian cancer? What kind of age were people when they were diagnosed? Or what kind of age did they pass away? That gives you much more useful information to go in depth. Death certificates. In the UK, anyone can order a death certificate from the General Register Office for a small fee. It's really easy online and will usually record the cause of death. This is how I found out my great-grandmother died of breast cancer in her 40s. No one in my family had ever mentioned it. You can check other genealogy records online. Sites like Ancestry I use, Find My Past, and they may also have uploads of death certificates, sometimes from really far back actually in time. And don't forget to look at both sides of the family. Inherited cancer risk can come from your father's side just as much as your mother's. Most people only think to ask about the female line when thinking about things like breast cancer risk. But BRCA1 and 2 and PALB2 mutations pass down through fathers too. Write it all down. A simple family tree with cancer type, age at diagnosis for each relative is much more useful to a doctor than a verbal summary, and you can bring it to any health or genetic testing consultation. The honest limitation, even though family history searches have gaps, relatives die early from something else, records are lost, causes of death sometimes are unrecorded. That's exactly why we know family history alone isn't a reliable way to rule out risk. It's a starting point, not a final verdict. If you want to know, regardless of what turns up in your family history, our inherited cancer risk test can test for over 30 genes lead to common cancers.